Welcome back to Metta Health Talk. Today, we are discussing a topic that is usually reversed for late-night magazines, but we are going to treat it with the medical seriousness it deserves. We are talking about sexual ergonomics. Just like you adjust your office chair to prevent back pain, you must adjust your physical intimacy to prevent injury and maximize function. Did you know that penile fractures are a genuine urological emergency that requires surgery within 24 hours? Did you know that standard positions can exacerbate a herniated disc in the spine? Today we are moving beyond the Kama Sutra. We are not looking for acrobatics. We are looking for optimization. We will discuss the Coital Alignment Technique for pleasure, the 90-degree rule for safety, and how to protect your joints while maintaining coordination. Let's start with the most terrifying injury in urology, the penile fracture. The penile is no bone. The fracture is actually the popping of the tunica alveolis, the fibrous sheath holding the blood under high pressure. When it snaps, it sounds like a branch breaking, followed by instant pulpal swelling, the eggplant sign. How does it happen? According to the Journal of Sexual Medicine, over 50% of fractures happen during the woman on top position, cowgirl. Why? Because the female partner controls the vertical motion. If the penis slips out and she comes down with her full body weight, the penis is crushed against her pubic bone or perineum. The penis cannot withstand that vertical force. The fix: if you enjoy this position, don't use a vertical bouncing motion. Use a grinding motion, circular hips. Or the male partner should hold the woman's hips to guide the alignment. Controlling the angle prevents the slip. Now for pleasure. The standard missionary position is actually anatomically inefficient for female pleasure. Why? Because the angle of thrusting often misses the clitoris entirely. Another Coital Alignment Technique, CAT, developed by psychotherapist Edward Michael. This is a modification of missionary. 1. High riding. The male partner moves his body higher up, so the base of his penis presses directly against the woman's clitoris. 2. Grinding. Instead of the in and out piston motion, the couple uses a pressure and grind motion. The pelvises stay locked together. 3. The rocking. The movement is a subtle rocking, sliding coordination. This technique maintains continuous pressure on the external clitoris while stimulating the internal structures. It turns a position that is usually male-forced into one that is highly female-focused without requiring any acrobatic flexibility. Rear entry Doggy Style is popular for visual stimulation and G-spot access, but this causes two major medical issues. 1. Cervical collision. Because the depth is maximized, the penis often hits the cervix, causing deep pain, Dyspareunia. 2. Anterior pelvic tilt. The woman often arches her back excessively, compressing the lumbar spine facet, leading to post-sex back spasms. The modification: instead of being on hands and knees, which creates a step angle, the woman should lay flat on her stomach, perhaps with a pillow under her hips to elevate them slightly, or she can lower her elbows to the bed. This flat doggy variation changes the angle of penetration. It aims the penis more towards the anterior wall, G-spot, rather than the deep cervix. It also flattens the spine, protecting the lower back from hyperextension. It transforms a painful position into a comfortable, sustainable one. For couples looking for intimacy, duration, and oxytocin bonding, nothing beats the sideline position, spooning. Medically, this is the low-energy expenditure position, since near partner is supporting their body weight against gravity. Heart rates remain lower. allowing for much longer duration without fatigue. It creates a maximum skin-to-skin contact, which releases oxytocin, the bonding hormone. Anatomical bonus: these positions allow for very easy manual stimulation of the clitoris by either partner fixing the orgasm cap. It's also the safest position for pregnant women, especially in the third trimester, partners with knee or hip arthritis, men dealing with premature ejaculation. The lower muscle tension helps reduce arousal urgency. Lower back pain is a libido killer, but the solution depends on what kind of back pain you have. Type 1. Flexion intolerance. For example, herniated disc. If bending forward hurts, like tying your shoes, you have a disc issue. You need to avoid curling your spine. Avoid standard missionary, legs up high, or spoons where you are curled into a ball. 2. Doggy style with the neutral spine, or placing a rolled towel under your lower back during missionary to maintain a slight arch. Type 2. Extension intolerant, for example, spinal stenosis, arthritis. If arching backward hurts, like looking up at the ceiling, you have joint compression. Avoid doggy style with the arched back. Do spoons with knees pulled up or missionary with legs raised. These positions round the back slightly, opening up the spinal canal, relieving pressure on the nerves. We discussed anatomy in the previous video, but how do we solve the mismatch ergonomically? Scenario A. He is too big, hitting the cervix. The goal is to limit depth while maximizing connection. A lotus, seated connection. The male sits cross-legged. The female sits on his lap facing him. Because her legs are wrapped around him, she controls the depth completely. She can lift up if it gets too deep. Side line, face to face. Instead of spoons, face each other with legs intertwined. The angle of the thighs acts as a natural buffer, preventing full penetration. Scenario B. He is smaller, losing friction. The goal is to reduce the vaginal space and increase friction. Closed leg missionary. Instead of spreading the legs, the female partner keeps her legs flat and squeezed together. The male rides on top of her thighs. This compresses the vaginal walls, creating a much tighter sensation and significantly more friction for both partners. Pregnancy changes the biomechanics entirely. Trimester 1 and 2. Most positions are safe, but comfort is key. Trimester 3. The uterus is heavy and can compress the vena cava if the mother lies flat on her back. This causes dizziness and reduces blood flow to the baby. Avoid standard missionary, flat on back. Do side line. Left side is best for blood flow, or doggy style takes pressure off the belly. Postpartum, after birth. Even after the 6 weeks clearance, the perineum may be tender from tearing or episiotomy. Avoid deep penetration or wide leg separating, which stretches the scar tissue. Do these allow for shallow depth and keep the legs closer together, protecting the healing pelvic floor muscles. To summarize, there is no best position. There is only the best position for your specific body, your partner, and your current health status. If your back hurts, change the angle. If you want more connection, switch to CAT. If you want safety, avoid the vertical bounce. Sex should never be painful. Pain is a signal from your body that the ergonomics are wrong. Listen to the signal. Adjust the machinery. Thank you for joining this masterclass on Metta Health Talk. If you found this practical guide helpful, please subscribe and share it with your partner. A little knowledge can save you a trip to the emergency room.